Hi everyone, my name is Crystal, and today we're going to be talking about Addison's disease. I am going to be reading from a paper, so hopefully it's not too distracting. I have a friend of mine that does videos on YouTube about her life with cirrhosis, and she inspired me to do this video, which I'm hoping will be informative and help explain. Even my family and friends aren't really sure what Addison's disease really is, so hopefully it'll shed some light on what I live with every day. So if you want to follow my friend on YouTube, her name is Melinda Davis. It's Melinda-Davis, and you can give her a follow and show her some love. I appreciate her inspiring me to do this. So Addison's disease is very rare, and that's why a lot of people don't know about it. In the United States, it's about 1 person out of 100,000 who get it. You can also say in the United States that between 40 and 60 people per million get it. If you look worldwide, it's about 100 to 140 for every million people. Secondary adrenal insufficiency is more common. That affects 150 to about 280 people per million. So, Addison's disease. Addison's disease is also called adrenal insufficiency. It's an uncommon disorder that occurs when your body doesn't produce enough of the certain hormones that you have. In Addison's disease, your adrenal glands, which are just above your kidneys, produce too little cortisol and often too little aldosterone. It occurs in all age groups, all sexes, and it can be life-threatening. So I have a drawing behind me that I drew, and my son helped me with this. It was kind of based off of this picture. So my drawing's a little fancier. Actually, my son's artwork. So anyway, you have, this is a brain, and you have the pituitary gland here. So with Addison's disease, when you are under stress, it can be mental or physical, the brain sends a signal to the pituitary gland to produce ACTH. And then the ACTH is sent from the pituitary gland, sends the signal with the ACTH to the adrenal glands, which are on top of each kidney. The inside of the adrenal gland is called the medulla, and the outside of it is called the cortex. And as you can see, there's the kidneys, and then there's your bladder. So the cortex and the medulla are what the adrenal glands are made up of. So with secondary insufficiency, that is where your pituitary gland doesn't send the signal to your adrenal glands, and that's called secondary adrenal insufficiency, and it's not considered to be Addison's disease. So what are the symptoms of Addison's disease? There are several, and they can mimic other diseases, other conditions, so you definitely need to see a doctor if you have these symptoms to rule out other things, to possibly rule this out. There's extreme fatigue, weight loss and decreased appetite, darkening of your skin, hyperpigmentation. You'll get darker skin in the folds of your skin, like your elbows or your knees, behind your knees, places like that. Low blood pressure with even fainting, decrease in your heart rate, salt cravings, low blood sugar, which is hypoglycemia, nausea, diarrhea, or vomiting, any gastrointestinal symptoms, abdominal pain, muscle or joint pains, irritability, depression, hair loss, sexual dysfunction, sores in your mouth, and also sleep disturbances. So with Addison's disease, when your body doesn't produce these hormones, you can have what's called an adrenal crisis, an Addisonian crisis. Sometimes the signs and symptoms of Addison's disease will appear suddenly. Acute adrenal failure, Addisonian crisis, can lead to life-threatening shock. So you need to seek emergency medical treatment if you experience any of these symptoms. Severe weakness, confusion, pain in your lower back, legs, or stomach, severe vomiting or diarrhea or stomach pain, that leads to dehydration, reduced consciousness or delirium, and also high fever or low blood pressure. And they will also take your blood to see if you are in fact in an Addisonian crisis. You should have higher potassium, which is hyperkalemia, and lower sodium, which is hyponatremia. So when should you see a doctor? You should see a doctor if you have the hyperpigmentation I was talking about, severe fatigue, unexplained weight loss, gastrointestinal problems, lightheadedness, salt cravings, muscle or joint pains. Any of those things, you need to see the doctor and see if they can test you for this condition. So what causes Addison's disease? It's been mostly known that Addison's disease is caused by autoimmune disorder. Your body thinks that your adrenal glands are foreign and mistakes them for being a foreign object in the body, and it basically attacks it and tries to destroy it. So your own body destroys your adrenal glands and you no longer produce the steroids or the hormones that you need to produce. So these hormones are produced by the cortex of the adrenal gland, and they are called glucocorticoids. These hormones, which include cortisol, influence your body's ability to convert food into energy. They play a role in your immune system's ability, the inflammatory response, and help your body respond to stress. Mineralocorticoids, these hormones, which include aldosterone, maintain your body's balance of sodium and potassium to keep your blood pressure normal. And then you have androgens. These are male sex hormones. They're produced in small amounts by the adrenal gland, but they're produced in men and women. They cause sexual development in men and influence muscle mass, sex drive, and sense of well-being in men and women. I would say that, there's the stereotype, if you're on steroids, that you're going to get big and buff and you're going to grow a beard or you're going to grow chest hair, with the women. That's probably not something you would want. That's not what this is going to happen. That's not going to happen to you. You are basically taking medication to replace what everybody produces normally. So you don't have to worry about that. So other causes of Addison's disease, besides your autoimmune system attacking and destroying your adrenal glands, are tuberculosis. That's a really big one that causes Addison's. Other infections of the adrenal glands, cancer in the adrenal glands, or bleeding into the adrenal glands. I'm sorry, that's my dog. When you have bleeding in your adrenal glands, that could be pretty dangerous because you could have an Addisonian crisis where you never had any symptoms at all before that you even had the condition. So that can be really, really scary. So with secondary insufficiency, the pituitary gland, it makes that ACTH I was talking about. That is short for adrenocorticotropic hormone. Luckily, we get to call it ACTH because that's not easy to say 3 times fast. So anyway, the pituitary gland sends that to the adrenal glands. So too little ACTH can lead to too little of the glucocorticoids that I just talked to you about and the androgens that you normally produce. So even though your adrenal glands themselves aren't damaged, the pituitary gland doesn't send the signal to them to make it produce. So people with secondary insufficiency don't really have the hyperpigmentation, and they're less likely to have severe dehydration or low blood pressure, but they are more likely to have low blood sugar. So the complications of Addison's disease are mostly just the Addisonian crisis. There's not a cure for Addison's disease. At this point, it is very rare, but I don't believe that people are making donations to research very often. And a lot of that's just because of awareness. I do have a t-shirt that I have for Addison's, and I also had a ribbon magnet that went on the back of my truck for a while. I need to get a new one of those. But anyway, a lot of people just have never heard of it, and they don't know what it is. They know President Kennedy had it, but he seemed fine. So it's another one of those invisible illnesses that people look fine, but they don't feel fine. So you can prevent having an Addisonian crisis. You should talk to your doctor right away if you feel tired or weak or you're losing weight. Also, you need to talk to your doctor about what you should do when you get sick. My endocrinologist has me double my steroid dose. I think that's pretty common among people with Addison's. I take it when I have a procedure done, even the dentist. I take it anytime before surgery, and anytime I'm sick or under a lot of stress, which like a death in the family or, you know, undue stress that you don't normally have, I double my steroids. So if you have Addison's, you're just going to be replacing, the medication is just going to replace what you normally make. So, so who's at risk for Addison's disease? People that have cancer, people that take anticoagulants or blood thinners, people that have infections like tuberculosis, if you've had any surgery that removed part of your adrenal glands, and also anybody that has an autoimmune disease like type 1 diabetes or Graves' disease. And then when you go to get diagnosed for your Addison's disease, the doctor will ask you about your medical history and everything and the symptoms that you've been experiencing. And then more than likely they will perform an ACTH stimulation test. I had this done 3 times. Like I said, I was diagnosed in 1997, which was 23 years ago. But I did not match all of the symptoms of Addison's disease. I actually had some of them that were opposite. I had weight gain instead of weight loss. Yeah. And also, I did not have the hyperpigmentation. I don't have the darkening of the folds in my skin. I do have all of the other symptoms that I've read to you earlier in the video. I have all of those, but I didn't match all of them. So they ran it 3 times, and finally a diagnosis was made. But basically what they do is you go into the hospital and you stay for the day, and they put an IV in. They will inject you with ACTH. Well, first they'll take a baseline cortisol level. Then they will inject you with the ACTH, which is what the pituitary gland sends, and see if your cortisol level raises. If, you know, they do it and then they come back at different time intervals. I'm not sure if it was 1 hour. I can't remember because it's been so long ago. But basically, if your cortisol levels don't go up, then obviously you're not producing the glucocorticoids that you should be producing, or the androgens. So the pituitary gland is working, but the adrenal glands aren't. That's primary. That's Addison's disease. Now again, secondary is when you don't have your pituitary gland working. It does not send in the signal to the adrenal glands. So those are 2 different things. There are some alternative therapies that you can do to basically try to reduce stress in your life. You could talk to your doctor about doing yoga or meditation. I've recently started doing meditation, and it's really hard. It's hard to get into if you've never done it before, because it's hard to let go and relax and just listen to somebody talk you through relaxing. But once you can do it, it's really helpful to reduce stress. So only a couple of other things I wanted to mention. One is that every year my doctor has me get a flu shot. And that's just, you know, protective, because he doesn't want me to get sick and have to double my steroids or possibly go into a crisis. Also, with the coronavirus going on right now, it's very important that you wear a mask all the time, because it can be pretty scary if you were to get the coronavirus when you're already sick, you know, with Addison's disease. And also, the last thing I wanted to point out was that you should always wear a medical alert bracelet. The last one I had was a chain with the basic plate that said Addison's disease on it. I did, however, buy a new one recently that was about $40 on Amazon. I'm not sure if you can see it from here, but this is like a bangle bracelet, and it has a heart in the middle with angel wings coming off of it, and then on the back of it, it has the medical alert symbols. And then on the inside of it, my bracelet says Addison's disease, and then it says that I'm allergic to penicillin, morphine, and Reglan. Those obviously are just my allergies, but I really like this one a lot better, because it doesn't get snagged on clothes and towels, and you know, it doesn't get snagged on stuff, so I like this one a lot better. But if you all would like me to start doing videos of a day in the life, kind of like my friend Melinda does, just comment down below, and I'll try to do those. Otherwise, I hope this video has been informative and helpful in helping people learn what Addison's is and all the symptoms that we have to go through every day. You know, it's like I said, some days you have good days, sometimes you have bad days, so it's very manageable. It's a very manageable disease, but it can also be a very dangerous disease. So you just have to take care of yourself and stay on top of your medication. So thank you for watching. I appreciate it. Y'all have a good day.